Hi, I'm Cindy Powell and I'm a physical therapist. I've been in the profession for about 17 years and I've been an orthopedic and sports therapist. And I'm here with Michaela today, and we're here at Rogue Valley Medical Center, and Michaela is a wonderful physical therapist who's been using the GlideTrak for over a year now.
Yeah, at least.
At least. Michaela, would you like to tell us a little bit about your background and how you ended up here?
Sure. I actually started in neurophysical therapy back in Michigan at a place called Mary Free Bed Rehab Center. And most of my initial experience was there in neuro with some orthopedics. And moved on to working over at Sky Lakes in the acute care setting. And have now moved on here to outpatient in neuro.
Wonderful. Well, since you've been using this GlideTrak for over a year in the clinic, have you found that body weight support treadmill training has an important place in rehabilitation?
I think it's very essential, in part, or especially with neuro patients, because what it does is it allows you to really practice that neural pathway. So what you're trying to regain is a highway system, basically, instead of one of the back roads. So if people can access a normal gait system again, a normal gait pattern, and they can practice that in, then I think it shows great potential for them to be able to do better over time.
And I bet it helps to be able to access the patients while they're on the treadmill, which is not always possible with other systems.
That is very beneficial. Many times I actually connect them if they don't have very good quad strength, for instance. I can actually put a TheraBand on the bottom and connect to their ankle, so that assists them to be able to bring their legs straight, and all sorts of things that you can correct by sitting in a stool and just being able to manipulate with your hands.
Outstanding. Do you find that patients can improve their speed, the actual speed of quality movement with the GlideTrak compared to on-land training?
It's incredible. Many people find that it's very exciting to them, because not only some people can't actually really walk without it, but additionally they can't walk at that sort of a speed. So I can really normalize somebody's gait instantaneously on the GlideTrak many times.
I'm curious, since I don't get to be in the clinic with you and see this, after you increase speeds and work on normalized patterns, do you see an immediate carryover when they step off the treadmill?
Yes, most of the time.
And that's what we're looking for. And then sometimes will people have carryover for hours or days?
Yes, absolutely. Again, it's a patterning issue where if you can strengthen the pattern, then there's carryover.
Fantastic. Well, in your opinion, does the GlideTrak seem to be an effective body weight support training system then?
Absolutely. It's a very good tool to have.
Good. And how important is it in your practice? Say, how many clients might you put on the GlideTrak a day, on a busy day?
That really depends, obviously based on our very diverse patient clientele, but we can have 2 to 3 a day for 2 therapists.
And are you the only therapist that uses this system right now?
I have a partner who works half-time,
Okay.
so it's he and I that are doing the majority of the neuro.
And would you see this being a wonderful transition for patients to homes, or are some of them capable of possibly transitioning to an outdoor version on the Glide cycle?
That is something that shows a great deal of potential for people, because it's a big problem. What do you do with clients who require equipment after they're discharged from therapy? And a lot of those people fall in between the cracks. So that would be ideal if you had something, some way for them to maintain their strength and their mobility after they're out of physical therapy.
I'm excited to find out what kinds of patients. So you see primarily neurologically involved patients, but what types of diagnoses and conditions are you using this for?
Oh, many. Starting with strokes, lots of stroke patients, lots of incomplete spinal cord injuries, multiple sclerosis where they can't fatigue and so you want to keep them at a lower level, Guillain-Barré, those are the major ones.
Goodness. Any people with head injuries?
Oh yes, and head injuries. Yes, we do that as well.
in Parkinson's? Have you had any clients with Parkinson's?
We have. I haven't used it as much with Parkinson's, but I think that it shows potential there too.
Good. Do you have any particular patients that stand out, or would you want to share a patient story that you've had where you've seen a change, or maybe something that you didn't even expect to see?
We actually put a client on together, you and I, at one point, who really was struggling walking around the gym. But when she got on the GlideTrak, she actually could normalize her gait pattern. And just because we could unweight her enough that she was able to use the muscles that were so weak that she couldn't walk without being unweighted. So that was very exciting.
It's exciting, and it also really hits you emotionally too.
It does. That's true.
I see that over and over again, and it's wonderful to be able to document those changes and share that with their physician, and it's
Right,
exciting.
indeed.
Well, how do you feel if a therapist called you up and said, I'm really, really looking forward to bringing in a body and weighted training system. Would this be a good system for neurological rehabilitation? How would you feel?
Oh, that would be great. I'd be happy to speak with any potential therapist.
Wonderful. And is there anything that you want to tell people about this system? Any therapist or anybody in the medical profession?
I find that this is a system that's very accessible financially, which really helps, and it's really quite easy to get somebody on and off, which as a therapist is very important. And I would highly recommend it.
Wonderful. So it seems fairly easy. Can you get people on and off in a matter of a couple minutes in most cases?
Yes. Yeah, the majority of the time.
Well, that's great. Your feedback is just wonderful, and it's helped lead to wonderful changes in the new seating system and the new GlideTraks, and it's
well,
just
thanks
been
for
so
letting
exciting.
me be part of the process.
Well, we're lucky. We're very grateful. So, and we've had a wonderful, wonderful experiences with therapists just doing amazing things that we never even knew were possible on this equipment. So thank you.
Yes, well, thanks, Cindy.
Well, happy holidays, and we wish you the best.